I'm sure a number of you, if you're watching this, you've had skin cancer. Most of the skin cancer patients we see are return patients. And so for years, plastic surgeons have taken care of a lot of facial cancers, and then deeper cancers that have gone into deeper spaces. And the dermatologists have taken care of a lot of the skin cancers, pretty much everywhere. The most uh, uh, skillful person to remove the cancers, I believe, has been proven to be the dermatologist that is a Mohs surgeon. So that usually requires 1 extra year of training after dermatology, in which they're trained how to process the tissue that they remove, stain the tissue, and then look at it under the microscope, such that they can remove things under local anesthesia, and test the edges. And that has been shown to have the lowest recurrence rate, which is great. Um, and it can be done under local anesthesia. We surgeons have been doing that same thing in the operating room for, well, many decades, if not generations, really. But it is something that usually the patient's asleep. There's an anesthesiologist. It's just not a very timely thing to do for small skin cancer, and much more likely to be done when you're trying to do margin control for a tumor that's grown, more deeply into other tissues. So, unfortunately, the Mohs surgeons, they don't have a lot of training, some maybe more than others, in doing the reconstruction. Many of them learn a skill set over time with trial and error, to do good closures. We plastic surgeons would certainly believe that we do the best job because we spend the most of time looking at and studying for years, the many, many different ways of reconstructing the very same wound, with various different techniques, grafting, free tissue transfers. There's just a lot that goes into closing wounds, cancer wounds, not just the small ones that you might find on the face or the hands. Um, so we I've listened to patients over the years, and I've seen patients that have come in and that have had uh, cancers removed and closures done very well by the Mohs surgeon. And I've seen others where the patient wasn't so happy. And I feel like, it's not every skin cancer clinic has access to both a plastic surgeon and a Mohs surgeon. So I put on my thinking cap, and believe have realized that what the public, what you would like mostly, would be to have your skin cancer removed by the most skillful person, and then preferably closed by the most skillful person for that duty, and preferably on the same day. And then I'm sure a number of you would also prefer that it not all be done with needles and local anesthesia, that there may be, in certain circumstances, other anesthetic options while achieving the best excision and the best closure under the same roof on the same day. And so we've conceived of a clinic, multi-specialty clinic called CosMOHs, the CosMOHs Multi-Specialty Skin Cancer Clinic. And basically what it will be is an accrediting body that will accredit clinics that do just that, that have a board certified plastic surgeon, a Mohs surgeon, all under one roof, trying to perform the procedures all on the same day, and offering various different anesthetic options, which I believe is really what people would like. And so we're looking forward to kicking that off in the near future. One of the things that really brought me to this was my mother-in-law, actually, at Vanderbilt, had her ankle basal cell cancer removed right off the ankle bone by, excuse me, a Mohs surgeon there, and it resulted in about a silver dollar size wound right over her bone. And they, rather than asking a plastic surgeon to come in and put a skin graft on it, and then it would have healed within maybe 10 days or 2 weeks, they told her to keep it moist with Vaseline. And so she did that for, well, 5 months before it finally healed. Had difficulty walking, all sorts of things. She was in her 80s. Finally, it healed. And I'm thinking, so I'm a microvascular surgeon, so I used to get called all the time for exposed ankle bones. So had she left that to dry out, and that very thin layer of periosteum soft tissue dry out over her bone, she would have needed to have gone into the hospital, spent weeks there having a larger surgery to close over the bone. Fortunately, she took really good care of it. She's a nurse and kept it moist, and it did eventually heal after 5 months. And so it's that sort of an outcome that I would like to avoid via this new clinic concept called CosMOHs. So look for it. You should be hearing about it in the airwaves and on social media soon.